a very warm welcome to ET Health World's fireside discussion on hydration beyond diarrhea for pediatric patients. The World Health Organization defines dehydration as a condition that results from excessive loss of body water. But to understand this critical aspect and the warning signs of dehydration in children, I, Rashmi Mabian, have been joined by Dr. Neelam Mohan, recipient of Dr. B.C. Roy National Award and currently the Director of Pediatric Gastroenterology and Hepatology Department at Medanta. Being a pioneer in the field of pediatric hepatology and liver transplantation, Dr. Mohan also serves as the president at Commonwealth Association of Pediatric Gastroenterology and Nutrition. She is the IAP National Scientific Convener of Diarrhea Modules 2020, 22, and 21, and IAP National Coordinator of Nutrition Education Program 2020-2021, just to name a few. Welcome, ma'am. We have a second speaker, which is Dr. Preeti Thakur, General Medical Affairs Manager at Johnson & Johnson's. She has pharmaceutical industry experience of over 16 years spanning across various therapy areas. A very warm welcome and thank you so much for joining us today for this very interesting fireside discussion. So before we start, I would like to tell our audience that there will be a question and answer session so attendees can ask their queries with our experts towards the end of the fireside. Now, beginning with our fireside, my first question is to Dr. Neelam. Why are pediatric patients more susceptible to dehydration?
Well, thank you so much, Rashmi, for having me over and the kind introduction and economic times to take an agenda which is really important because I guess there is lots to be done in the field of dehydration. And I'll take you through the journey about what needs to be done and what have we achieved so far. But it's a very good question, why? Now, the truth is, both adults and pediatrics, when you get dehydration, both of us will be predisposed to dehydration. But what happens is, in children, the volume of water in the body, the percentage needed for your various metabolic plants in the body is higher. So like I'm just trying to show you that right from 90 and when you're born, it is 80%. So an infant might have something like 75, 80%. Then you go to a child who's got 70% to an adult, which is 60 to 65. Having said that, now we know that you and me as adults have almost 5 liters of, blood in our body, what we say. And so I'm trying to say that 60 to 65% of it, if it is in the form of water, the percentage of water reduction matters. Suppose I have a 10 kg baby, then the blood volume of the 10 kg baby is going to be approximately 700-800 ml. So out of 700-800 ml, if a child has a stool, say that is, you assume the stool to be just 25-30 ml, which means 2 tablespoons, I'm saying. And if the child has a little bigger stool, 50 ml. So 4 such stools or 3 such stools is going to make you 150 to 200 ml. Imagine that 150 to 200 ml is going to be virtually of the 800 ml fluid you have is going to be 25% of loss. So for an adult, you will, you wouldn't mind 3-4 stools ho gaye and, like you wouldn't think that your percentage out of that 5 liter has gone up. So that is what is important to understand, that the children are more susceptible because the percentage of the volume of total volume of fluid versus the need for the higher requirement that is there. And I would just like to bring to your notice that what happens is sometimes, like my patient says, to kya hua, sodium kam ho gaya, potassium. When you keep insisting for them to take ORS or some fluid which has got sodium. So first let us understand the physiology. Why? Because this sodium is actually very important to maintain the fluid balance at the membrane potential. So your blood pressure in the body is also dependent on the sodium. And we've heard adults saying that BP high hai, sodium namak kam ka, and all that stuff. So basically, the membrane potential is dependent on sodium, and the transport across the membrane is dependent on a gradient. The ATP energy transport is also based on this sodium and glucose, this energy transport. And similarly, the potassium is essential for the cell metabolism and maintenance of this membrane potential. So this physiology you need to understand to answer your question. And once again, I'm trying to say that since the body water requirement is as there's going to be greater fluid volume needed to maintain the fluid equilibrium in the smaller children who have more higher percentage as compared to adults. And that's what I had to say.
Thank you so much, ma'am, for explaining the important components in it. However, could you also tell us what are the commonest cause of dehydration in children and how should one address it?
Yeah, now, see, it's like I always say people, like when we talk about nutrition and feeding in an infant, whatever it goes, we have to keep saying again and again and again the importance of breastfeeding. Just like that, I would like to say today that whenever you talk of dehydration, though our title was Hydration Beyond Diarrhea, but I think it is very important for me to take the opportunity to say that, of course, there are other causes beyond diarrhea which are important, but I would like to emphasize a couple of points to make sure everybody here is familiar with the fact that one of the commonest cause of dehydration in children is diarrhea, where you're losing out of your body. And if you had acute gastroenteritis, that means diarrhea, you're losing, and vomiting. So you're vomiting, so your intake is also getting lost. So high output, low intake, or even output from the vomiting is going to be disastrous in the form of dehydration. And though we've advanced so much in our country, yes, if I talk about the last 2 decades, we have been able to bring down our under mortality. But still, if I talk about the overall mortality of worldwide children with diarrhea, in South Asian countries lead the top. Almost virtually 80-90% come from this part of the world. And India is sadly still we have third leading cause. Following number one is preterm, for number one is infections, number two is preterm births, and after that is diarrhea. And the others like malaria, etc., tuberculosis are all below. So I thought we should take this opportunity to tell you all that you need to focus is when there is no dehydration. Right then, you should believe in prevention is better than treatment, and therefore work hard here without signs of dehydration. Replace the fluid that you're losing through diarrhea or fever or blood loss, insensibles, etc., with this solutions like ORS to make sure that the body doesn't get into some dehydration, which is when you're restless, irritable, drink eagerly, you feel thirsty, and a skin pinch where you do it on the abdomen and you pinch the skin of the abdomen between the umbilicus and the right superior iliac spine. So when I pinch it, it should go immediately. But if it takes some time to go back, that means there is dehydration setting and the need for ORS. But once you get into severe dehydration, then we end up with problems. So in no dehydration also, you need either the home-based fluids or the ORS. And as I'll take you through the journey, we'll talk about solutions, we'll talk about powders, etc. We'll talk about the drawback of the strength of the solutions, how to mix them. And we'll talk about before dehydration. Yes, you can use some yogurt, rice water, preferably salted. I use the word salted because I want sodium in it. And coconut water doesn't have so much of salt, but a little bit more of potassium. But remember, I repeat, remember, do not use tea, aerated drinks, fruit juices. They increase the osmotic this thing pressure and give rise to further diarrhea. We've had parents who actually end up giving juices like apple juice and orange juice, etc., which is wrong. If there are few take-home messages that you want to take, that was an important message that I gave about what to give and what not to give, even when you didn't have dehydration, but to prevent dehydration. And of course, when it comes to some dehydration, prepare ORS, give 70 ml per kg of ORS over 4 hours or so. Evaluate after 4 hours. If the patient is vomiting like a child, don't ask the child to drink the whole thing. Give one sip, wait for 5-10 minutes, give sips. So even if you had to give to a child normally, so you keep giving sips like rather than the whole thing, and then you wouldn't want, and don't stop feeding like breastfeeding to a small baby, because infants should continue with breastfeeding along with that. But older children, yes, we say that do not continue with nutrition, calories, carbohydrates to give you the energies. Otherwise, you will end up with severe dehydration. And once you have severe dehydration, I have no other plan but to admit to plan C. So, my dear colleagues, work on plan A before dehydration sets in. And if it sets in, work on plan B. Thank you so much for that opportunity for me to talk about the importance of dehydration and diarrhea and ORS, which help to successfully reduce the mortality in these patients.
When we talk about besides diarrhea, is dehydration also a complication in various other illnesses?
So that's what today we've gathered to say, that besides diarrhea, the common day-to-day life, we all get fever, viral fever, loss of appetite. Simple maths I would apply in science. One, what goes in. So if there is a decreased intake. Two, what goes extra out. That means diarrhea or vomiting. Three, what you do not realize, but it is going from your skin, perspiration, fever, that you forget, or breathing fast, hyperventilation. So this we often forget to calculate. So it becomes very big challenge for the clinicians, because in children it becomes very difficult to assess, especially if they are malnourished or small, to assess how much fluids they need. And that is very important in your assessment, so that you can prescribe the right fluid in the right amount. If a 10 kg needs 1000 ml, I'm trying to say, remember that that's the basic, and you should give rather extra for the insensible losses or fever.
And when we talk about dehydration, is there a role of carbohydrates along with fluids and electrolytes in recovery of this?
Yeah, that's a very a good question, because while I was focusing, I like to always say, बाल से लेके नाखून तक, you need nutrition for recovery of anything. Without nutrition, and I also talked about the initially when I spoke on a slide, and I told you the importance of sodium, and I said ATP is energy, and I said sodium, ATP. So the pump is actually the sodium and glucose pump also. So you need carbohydrates not only for the transport of this pump, but also for energy. And simple things in life is when you are underfeeding during your basic, there is a resting expenditure energy. So therefore, after that and during that, you should ensure that you are able to give fluids, and along with fluids, you need carbohydrates, energy in your body, because energy is very important. There are people who just take glucose and drink. That is sometimes not very good, because if you have an electrolyte loss, just taking glucose water won't help. Similarly, if you have diarrhea, then again taking glucose water is going to be disastrous, because you're actually increasing the osmotic fluid in the intestine and give rise to more further diarrhea by that. This very few people understand, and quite a lot due to ignorance. Physicians and people, we forget to give the right message that what fluid to take, how much electrolyte should be there. This is something which is very important and talk of the day today, because it is this balance between your sodium and glucose which helps in this transporter, which I said, the sodium glucose transporter in the small intestine lumen, the intestinal lumen, and therefore gives rise to rapid absorption. Once you have rapid absorption within the bloodstream, absorption means the fluid getting into the blood. Once it goes into the blood, the load which is going in the gut, in the lumen, will reduce. And thus, the diarrhea will also reduce, because the gut load is going to be less.
And your learnings are instead very insightful for us. But looking into your practice, what are the other common causes of dehydration besides diarrhea in pediatric patients?
Yeah, that's so true. And I think I agree with you, Rashmi, that what happens is we have been always giving talks on diarrhea, and we forget to communicate sometimes to our parents the basic thing, because mentioned to you, infections are very common and we see throughout, I'm sure all of us have gone through a phase where two or three viral infections we've had, and people would have had typhoid, malaria, etc. in children. And what really happens is, again, the simple thing that I always say, that putting maths into science, that half the time, whether it is your liver illness, whether it is your kidney, whether it is your throat infection, mouth ulcers, what happens? You're not able to take fluid. You're not able to eat. So anything which gives rise to, and similarly in children, we forget that we are so much concentrating on khale. To khale, thodi takat aayegi, to khale. I always tell parents, it's not all about eating. Ensure that they get their fluids too, because, and also give very good energy density. I hate giving low energy when they're eating. So when you're eating, don't give diluted stuff. Give them good calorie stuff when they're getting, and anything which gives rise to increased output, vomiting, diarrhea, fever, sweating, fast breathing. And sometimes, like, these are a little complicated stuff, but when we do see, as specialists, we see, kidney issues, sepsis, infections of the intestine, peritonitis, burns, ascites, where there's a third space loss. That's what we say, because there is a capillary leak and there is a third space lock, which you will not be able to assess or calculate this third weight loss, because you're not seeing the person taking out through stool or urine. But because of this third space loss also you get. So my message to you all is that when children have high fever, especially very high, like 40 degree, which is 104 plus, you have a very high risk of dehydration. And even above simple normal 37.5, above that every degree. So 38.4 is like 100 point something. So even with every degree rise, you need to increase 12%. of the fluid. Where do we do it? We always forget it. So that is a very important point today I want to highlight, that for every degree rise of temperature and for the hours that you had, you're losing water. And remember that fluid intake is very important. To tell you more, Rashmi, what we see in common practice is fever, which I said. Besides that, I would see malaria, I would see typhoid, I will see bronchiolitis or a UTI. And dengue season, this is a disaster because there is a complete papillary leak and it goes out. And to prevent that severe dengue, we only talk about prevention. One is about the mosquito breeding, and the second is even at home, you don't need to. You need to be at home and keep taking lots of water and monitor your blood pressure. Just like COVID, you take water and monitor your pulse ox saturation. In dengue, we monitor blood pressure. And these are other diseases in children like chicken pox or hand, foot, mouth, etc. These were the common, but sometimes we do see rare conditions, but not so rare in children, like motion sickness. And heat related problems, I'm going to talk a little bit extra after this, but the other common causes like pancreatitis, diabetes, burn, liver issues like jaundice, hepatitis A, behavior related, young adolescents getting into anorexia, anorexia nervosa, not wanting to drink, UTI, all these things you need to remember that they are giving rise to dehydration. And I promised you that I'm going to talk a little extra on heat, because heat is something during summer season that when you are exposed to this, you could get symptoms as simple as cramps, which is pain in the muscles, arms, or leg, or you could end up with heat exhaustion, wherein you can have nausea, vomiting, dizziness, etc., intermittent subconsciousness. And heat stroke is something we would be dreading and quite often seen in children, because parents don't realize that if they have been a lot of exposure to heat, and then they could end up with even dore seizures, they can help it. And all this could have been prevented by ensuring that you were giving fluids and sodium to your children during exposure to heat.
Thank you so much, Dr. Mohan, for beautifully explaining each and every aspect. Dr. Preeti has been patiently listening to us. We finally come to you, Dr. Preeti. So, when do you recommend oral fluid electrolytes and energy?
Thank you, Rashmi. Thanks for this question and thanks for having me here. I think ma'am has really very nicely explained in terms of getting maths into science and how do we really have to take into consideration what is coming in and what is going out. So when a child is ill in conditions, even if we look at conditions beyond diarrhea, it becomes really critical, important to replace fluid electrolytes as well as energy because the child is not eating properly and therefore these fluid electrolytes and energy is required. If we can move on to the next slide, what is going to really help in accelerating recovery for the child in addition to the core treatment that the child is going to receive, hydration really plays an important role. And when we are talking about hydration, it may not be only from a water perspective, but it is also important choosing the right fluid which has electrolytes, which also has sugar that is providing energy to the child. And this is over a period of time going to help the child to accelerate the recovery or for faster recovery in conditions beyond diarrhea. If we move on to the next slide, why oral hydration is really possible or really important, because it is something which can be really quickly initiated. The mother can initiate it for the child when she is aware about, when she is educated on need for hydration and energy management. It is cost effective, and at the same time it is not associated with a traumatic experience that the child may have because of an IV prick, etc. In addition to it, it is also not having complications which may be because of prick. Then there may be extravasation, there may be inflammation in the tissue, and again pain which adds to the child. So therefore it becomes really important that we start the oral fluid electrolytes and energy in a timely manner to accelerate recovery for the child.
Thank you.
So well said, Preeti. Absolutely. I think this is very, very important for us to remember this 1, 2, 3, 4, the way you portrayed it. That never think about getting into the need for an IV. It's oral, and try to use as much as you can.
Thank you, Dr. Mohan. The next question is to you. What is the appropriate fluid to be recommended for replacement in pediatric dehydration?
Yeah, this is a very interesting question, and I'll actually want to tell you about a journey. Now, this is, just like we talked about, penicillin has been one of the biggest advances in the history of medicine, where we got an antibiotic. According to Lancet, the biggest sort of the advancement in the century was of an ORS. What do I mean? Millions of people were dying because of diarrhea and dehydration. So it was that initially that this 1969 that they came out and said UNICEF and WHO, they approved and distributed a balanced glucose electrolyte mixture. But in this, glucose was around 90 milligrams per liter, and so was sodium. Now, as a mother, what we always want is that we always wanted something that should reduce our the frequency of diarrhea. So the mothers, though they were using the ORS, they were not very happy. They felt that they wished that there was something which helped in reducing the diarrhea. And the ORS that we were using was actually high sodium and high osmolarity of 310. So that used to give rise to more vomiting, etc. So this ORS subsequently, they did studies where they reduced the sodium from 60 to 75, and they reduced the osmolarity from anywhere between 215 to 260. And with that, they found that there was a reduction in 30% of vomitings and 20% by even stool. How did this happen? I'm going to show you in a slide. So therefore, though ORH was supposed to be, I mean, when I was a student, we were all talking about the standard ORS. And we had this ORS available in the market. But subsequently, as I said, the sodium was brought down to 75 and the glucose was brought down to 75 with a potassium of 20 and an osmolarity of 245. And this was called the low osmolarity ORS. And this various studies which we did 210, 260, this the best, so they had to choose one number and they chose to 45. They showed 30% reduction in vomiting and 20% reduction in, because as I said, once the osmotic load was less, it was getting more absorbed into the blood, because the blood serum osmolality is around 290 to 300 to 90. So it is, we always know physics that it will go from the lower to the higher. So when you had this lower, the fluid was getting into the bloodstream. Once it gets into the bloodstream, the lumen, the intestinal lumen, because you're taking the fluid orally, so the lumen will have less fluid because it has got absorbed and got into the blood, and that's why the weight of the stool, that reduced. So that is why the WHO consensus in 2001 as well as subsequently 2006, we always have the WHO which talks about the low osmolarity ORS only, which is 245 and 75, 75 and 20. But of course, the range that the studies were done with which they chose this 245, those studies varied between this rate and they found the best as this rate. So that is what I wanted to highlight to you, the way there was advancement, and that is the right solution to be used, wherein your osmolarity is not very high. Somewhere between 245, 260 is an ideal osmolarity, but it should have sodium around 70 and potassium around 20 with the glucose around that.
Agree with you, Dr. Neelam. Indeed, those are some of the important things that have to be kept in mind when we are managing dehydration. However, some substitutes just don't forget to leave the parents' mind, or also when it comes to their children. And a similar question of that sort is for Dr. Preeti. Should coconut water and apple juice be recommended for dehydration management?
Yeah, Rishmi, I think that's a really a interesting question, and parents would typically ask around it. I think ma'am has really explained in terms of how should be the right formulation, what should be the right formulation that needs to be chosen. If you look here on the slides, these formulations, they have varied concentration when we look at the sodium and potassium. Especially they are low on sodium, they are high on potassium. So is that a right formulation that needs to be chosen in patients who have diarrhea, also in patients who do not have diarrhea? So in illnesses where we are looking at dehydration beyond diarrhea, choosing the right formulation, which is not only going to provide the fluid, electrolytes, and at the same time calories, because ma'am did mention about supplementation of the calories in form of sugar should be the right choice. And ma'am, your comments as well on this.
Yeah, I think I would agree with you, Preeti. And as I said, what I want to say is I want to give this message loud and clear to all parents there and everybody for them. Do not use apple juice, orange juice, cola, Gatorade. You'll be shocked. I get parents who are actually using this, and educated parents. I remember vividly during this COVID time, I was doing an online consult, and I had this mom talking to me about diarrhea. And fortunately, the child was around 25 kgs or 27 kgs. So, imagine if this child was a little smaller, and all that the mom was doing was giving this, juices. And so, this is something which I'm against it. And coconut water, what I would say, is the best amongst all. So, if you think that you do not have dehydration, but your question was talking dehydration. But I'm just going a step beyond that. If you wanted to prevent dehydration, then in that I could have said, yes, use coconut water as a fluid to prevent. But your question said dehydration, and there I think the one message that I would want to bring is use ORS. The government is giving cheap for those who can't afford, and otherwise these powders and solutions are pretty reasonable for us to go and have them. That would be my message, dear.
So, like, ma'am, you said about the pouches that are being given on ORS. So, should parents use home-based ORS also? Is it okay for them?
Yeah, actually, so true. When we were residents and almost 15 years back, 10 years back, when experts used to take presentations on diarrhea, they would always talk about home-based ORS. And when I went in, I mean, I've been fortunate that 2000, was it 8 or 12? I did the national guidelines for diarrhea. And I was very dogmatic because there's something like a paradigm. Paradigm मतलब मेरे से पहले किसी ने किया तो मैं भी वही लिखूंगी. So the paradigm continued that you always write WHORS oblique home-based ORS. It kept on in all the guidelines. And when I was doing the guidelines for the biggest Academy of Pediatrics in the country, because the talk is on pediatrics. So we all know that the biggest pediatric society is called Indian Academy of Pediatrics, IAP, which has more than 35,000 registered pediatricians. So I was fortunate by the grace of Almighty and my peers and colleagues to be chosen to help in those guidelines. And guidelines are not made by one. Remember, there's nothing like M. I could be leading, I could be the coordinator, I could be the leader and head. but they are all W, V. We make it all together, and so that it's utilized for everyone. So I was very dogmatic in putting it in that guideline that ideally do not encourage, because there are so many errors in preparation. We used to say, एक गिलास पानी में चुटकी भर नमक लो, एक चम्मच चीनी लो. अब किसकी चुटकी कितनी है? मेरी चुटकी इतनी है, रश्मि की चुटकी इतनी है, प्रीति. The errors that would occur very huge. So I mean, I would think that the WHO ORS and the powders and solutions which we have, we should use them rather than use this. But when you are in a desperate condition, of course, you have nothing in hand, and there's been pouring of diarrhea or vomiting. Of course, this message is there. You can forget the word ideal there. Then you can mix in a liter of fluid 8 spoon of sugar and 1 spoon of salt, level teaspoon of salt, level teaspoon of sugar, because that is also very important, heat level. So to reduce this, I'm giving you how to make it, but I said it should not be ideal. So I hope my message was clear, Rashmi.
Thank you so much, ma'am. That was indeed a very insightful and very important takeaway for the parents, especially who may be resorting to jugards as well. Now, I have a question for Dr. Preeti. What should be the duration for fluid, electrolytes, and energy recommendations, according to you?
Thanks, Rashmi. And if we can move on to the next slide, we have already heard from Dr. Neelam in terms of how and why the child is susceptible to dehydration in any acute illnesses, be it diarrhea related or be it non-diarrhea related condition. In addition to it, the evidence also says that about 6 out of 10 children do not meet adequate intake of water from fluids. And this is in normal conditions. So we can always imagine what the situation would be when the child is really not well and is having any acute illness. So therefore, there is surely going to be a deficit which is there for fluid, electrolytes, as well as energy. Choosing the right formulation also becomes very clear. When the child is having diarrhea related dehydration, we have to really choose the right formulation which is providing the right osmolarity. If the dehydration is beyond diarrhea, like in conditions other than diarrhea, we have to choose the formulations which are going to provide the fluid, electrolytes, as well as the energy. And this supplementation should start maybe, I would say, from day one of illness and continue till the child experiences complete or has complete recovery.
Okay, moving on to the next question. Is there a role of scientifically formulated, ready to drink formats, and why?
Thanks, Rashmi. And this is again another very interesting question. And we already have heard in terms of there can be errors when we are preparing the formulation or the solution at home, preparing solution even with the powders that are available in the market. So what is the right way where we can avoid these errors? So whenever there is a pre-mixed or a ready-to-drink fluid that is available, the fluid will usually typically call out what is the composition, what is the right quantity of fluid, what is the right quantity of electrolytes in it, and at the same time, how much sugar is there. Looking into it, the physician can always recommend the right formulation. So on one hand, it is guaranteeing the right quantity of fluid, electrolytes, as well as energy. On the second aspect, it is also a quality standard. So then it takes care of there may be potentially unhygienically prepared solutions which may be given to the child. So it takes care from a quality aspect as well. And third, very important point when it comes to the child is with respect to the palatability and how do we ensure that there is compliance for the child. So with these ready to drink formats that are available and they are easily palatable, that is again helping to increase the compliance in the child who is actually ill, not well, not eating properly. So as I had said earlier, while the RTD is going to provide the right quantity of fluid, electrolytes, energy, it becomes really critical and important to choose which one for which condition and appropriately recommending it for the child.
I think your word is very important, which for when. There should not be any confusions in that, because there are some products available in the market where there can be criticism if you don't if you choose the wrong product. So it is very important to be updated. Hopefully when there are some questions we can take subsequently, that you should know what fluid to take. That means, for example, there are this ORSL called ORSL, and I would also want to bring to the knowledge of audiences that when ORSL was used, it did not, it was, though it used to be called as ORSL, it was not the low osmolarity, and there was a lot of criticism for why it is being used. So the name was subsequently changed to ORSL, that dash L was removed. And I think that was a very wise thing to be done, because ORSL is not low osmolarity ORS.
Yes, ma'am.
It is rather ORS rehydrate, as the name indicates, rehydrate. That is what is to be used in rehydration or in dehydrating condition. But the others are not meant for dehydration. They are meant to be used to prevent dehydration in conditions which are other than diarrhea. So I appreciate Preeti said that knowing what to use and when to use is very important. And that's one another message of our talk today, is no point using a liquid without remembering what I said. Serum osmolarity should be around 245 to 260, and sodium should be close to 60, 70. Glucose should be around whatever 60, 75. Remember to read this when you are taking a product. So with that, I guess we are almost to the end of our talk.
So, ma'am, coming to the last question, you've almost covered this part, but we're just going to do a recap. What are the best practices to ensure optimum level of hydration in pediatric patients?
Yeah, so for that, I would say, as you said, let's recapitulate that first thing. Whenever there is an acute illness, there's going to be an imbalance either because of a poor intake and your fluids are going to get less. So you'll get into hypovolemia, or you're going to get losses out of your body, which could be right from fever, skin, diarrhea, vomiting, etc. And remember that the children have a volume of distribution. I mean, they have a smaller relative proportion of volume, and they have need for higher percentage of volume that is required. And generally, there is a tendency in children in illnesses to drink poorly. All this give rise to problems of dehydration. And it is not only dehydration, but in other conditions that also today we try to impress onto you that diarrhea or non-diarrhea, you can have dehydration daily in your day-to-day life. And don't forget that you can do this to prevent it by using the drinks which not like juices and apple juice and Gatorade, etc., or teas, etc. Use the right amount of fluid which has glucose and sodium and some calories, but the osmolarity is not very high. That is very important to be looked, so that not only because of diet point of view, I mentioned to you the sodium potassium, the sodium glucose pump, so the absorption is better in the right thing if you give glucose along with the sodium. And we showed you several studies where caregiver do not know how to make the ORS. So today we are trying to impress that if you're pushed to a corner, otherwise let's avoid using homemade ORS. And in the ready-made powders, please read the instructions. If it says powder in 200 ml, mix in 200 ml. I've had patients who mix the powder of 1 liter, which is supposed to be mixed in 200 ml. So the child comes to me with high sodium, hypernatremic dehydration, which can damage your brain, because when your sodium goes more than 160, 65, you can have brain damage too and seizures. And that were just due to ignorance of the mother, by not reading it carefully and mixing the powder of 200 ml in 1 liter. Vice versa, you can mix the powder of 1 to that. So my second message was best is ORS powder, but if you use the powder, you should be very sure that you're mixing it correctly. Alternatively, ready-made solutions are available for children to increase the palatability and errors in that, and read it, use it at the right thing. Don't use the rehydrate one, and don't get confused that ORSL, ORSL, ORSL is meant for preventing the dehydration in non-diarrhea causes, because it has good amount, and there is something like ORSL plus which has got extra taurine, calcium, magnesium, which we know taurine is an antioxidant effect, and they are good for the muscles. So especially in viral illnesses, when you think that they could have muscle cramps, you could use this ORSL plus, but otherwise be careful not to use them in diarrheal conditions. And this was just a study, recent study, which talked about how people, caregivers actually ended up making mistakes, a lot of them do make mistakes in preparing the ORS solution. So these were my messages. Remember that fever is associated with increased metabolism, which can result in dehydration. And you need also energy and glucose for recovery from the condition. Though you may not be thirsty or hungry, keep giving some fluids to the child so that you are getting continued fluid and energy provision. And in cases when there is some viral illnesses, and in that you can give supplements which can enhance the muscle. And my talk would be incomplete in this COVID era. Today, the highest number of COVID cases yesterday, more than 95,000 yearly in one day in India. So without touching on COVID, my talk would be incomplete. Even in COVID, what is very important, I said, you need to monitor, keep taking your fluids, ensuring that you do not get into these issues, that even the guidelines for COVID always talk that majority need to be at home. They don't need to be in the hospital. And when you are at home, ensure that you are taking the fluid replacement for your fever, ensure you're taking the calories, ensure you're taking the fluid. So that was my key message today with all this. Over to you. Thank you so much, Rashmi.
Thank you so much, Dr. Mohan. We will be quickly jumping into the question and answer session since we have less time. The first question is from Dr. Ivana. Now, she wants to know, since breastfeeding, nutrition, microbiome, and gut plays an essential role, especially from pregnancy up to 3 years old, how can India take a lead role in Southeast Asia to educate about this use of it?
Absolutely. So to the doctor, you will be happy to know that we have European guidelines, North American guidelines, and the Asia Pacific guideline. And yours truly, Dr. Neelam Mohan, I was the representative from India to make the guidelines on probiotics in the Asian Pacific guidelines. So probiotics is a very dear subject to me. Sometime I'll talk to you about the gut microbiota and the probiome, and we are doing great. So you should be happy that for breastfeeding, we always talk. And if you noticed, despite the title of the talk was, whatever, hydration beyond diarrhea, I ensured that I spoke few slides on diarrhea. And when I spoke on the management, I ensured to say that continue breastfeeding, because we should not forget our base. We should shout and tell the world that let's not forget to use the breastfeeding. And for breastfeeding, even with the use of antibiotics, if you remember my slide when I said ORS and zinc, and antibiotics are very rarely needed because by use of antibiotic, you're going to destroy your gut microbiota and gut microbiome. And by destroying the gut microbiome, you're predisposing yourself to obesity, and further, because of obesity, you have the entire things, the fatty liver, the insulin resistance, and I can go on talking about how the gut microbiota can explain everything, including "Main Aise Kyun Hu," that song is based on my gut microbiota.
Thank you so much, ma'am. The next question is about osmolarity. What should be the osmolarity of ORS in diarrhea management?
Yeah, I said to you that the osmolarity should be 245, and I explained, I don't know when you joined in the talk, what I explained is that initially we were using the ORS, which we used to call the standard ORS, which had 90 milliequivalents of glucose and sodium, and the osmolarity was more than 300. And the major thing was, yes, it prevented dehydration and we could do, but generally the concept, we were not able to reduce the incidence and frequency of diarrhea. And they thought that they were probably vomitings were higher. So they typical ye dil mange more, a lot of studies were done, and my mentor, I've done my post-graduation and in pediatric gastroenterology in India from AIMS, Dr. Ban, he was working a lot on this low osmolarity ORS, and at that time I was involved with him when the studies were happening both in Pakistan, in Bangladesh, and in Delhi. So the world who were giving this concept about low osmolarity ORS and zinc came from us and these countries, Bangladesh and India. So that is when we showed that if you reduce the osmolarity to, the studies were in the range of 210 to 260, but we have to give one figure. When we tell somebody do so many things, there'll be confusion, there'll be khichdi. So you want to give one message, and that one message was chosen as 245 based on these studies which were done, and that's how the low osmolarity ORS came. Then there was a phase in India where you used to get standard ORS and low osmolarity ORS. Gradually, the standard ORS was removed from the country, and today in the country we get only low osmolarity ORS sachets.
Ma'am, the next question is in rural areas, mothers do not know how to use ORS solution, especially the time intervals between the first and the second sip. So, how could this be resolved?
Right. So I think that's what the entire country, since I said this is the third most commonest cause. If you look at the NFHS data, the NFHS survey, which is National Family and Health Survey. Now, when they do the survey, now you and me talk ORS, but when you do the survey, we look at the prescription. So even if the doctor has said ORS and the doctor has not prescribed ORS, that was taken as not given or not prescribed. So sadly, majority of the prescriptions lack the word ORS. And the last 10 years, I am working strongly in the diarrhea modules in the country. I mentioned that the first diarrhea module of IAP 10 years back was, headed, I was the national coordinator. And again, I've been the national coordinator last year for this. And I'm blessed by the Almighty that I was chosen to be the co-chairperson by endeavor by Ayushman Bharat Niti Aayog endeavor with ICMR, and we have come out with one paper national which is going to go, and that paper is going to all, and I'm humbled to say that I was the one of the persons involved in this team, which was of 6-8 people, and by the grace of God, I was leading that along with Shinjini to get this paper all over the country in all centers to, to the nurses and the word is getting out of my mind, the the ASHA workers. The ASHA workers have to be trained. And ORS is so cheap, so simple. We just need to teach. So in that paper, all that we're talking is how to assess dehydration, how to give a replace. So that is why I said when you have some dehydration, I showed a slide. So very simple, when you're thirsty or your skin sugar is getting reduced, irritability, you have some dehydration, give 75 ml per kg of this ORS, and government ORS is almost free in health centers, and even the paid ORS is not more than a rupee or two. And even in the rural area, both the radios, the stars, the movie stars, etc., are being utilized to convey this all over. And I think over the radios we keep hearing it, and the ASHA workers are keep talking about it. But we doctors should give the prescription. We should write the word ORS. We forget writing the word ORS, which is wrong. We should write it either in the form of a drink or in the form of a powder, but do write on your prescription bag.
Ma'am, the next question is some practicing
pediatrics to go before we wind up 6. So last question.
Yeah. So some pediatricians today give antibiotics and other antidiarrheals and do not give zinc supplementation. How can we minimize the flouting of standards, IAP/GOI guidelines?
Government of India, how can we minimize, what did she say? Last line.
How can we minimize this floating of standards from IAP and GOI?
Yeah, so that's what now IAP is digital, and I'm also taking this module all over. And in the digital website of IOP, we are talking all about this. And once this paper, which I said, with which I was working with ICMR and Niti Aayog, this would be all over. So there are standard things which are going to go. And zinc, we say less than you give 10 milligram less than 6 months, or we give 20 milligram. So 20 milligram standard zinc, and that it is time that we stop writing antibiotics, and antibiotics are only needed in a handful of conditions, and those conditions are like dysentery, when there is blood in the stool, or when there is cholera, or when there is malnutrition, or when there is systemic infection in the form of pneumonia or UTI. So these are the conditions where you need it, and not for all the watery diarrhea you see, because watery diarrhea is viral. My dear colleagues, today, one of the important messages I want to give is say no to antibiotics when you don't need. These dehydration can be treated with an ORS. That is what. And zinc is just to increase your immunity. Zinc is just to increase the rapid turnover, because the mucosa wall gets degenerated by diarrhea. So for that you need it. And they say that if you use zinc, to the tune of 20%, you can reduce the probability of further diarrhea and further respiratory infection, because it improves the immunity of the mucosal wall.
Thank you so much, Dr. Neela Mohan.
Responsibility, I said, is not you, is not me. It is we, W-E, we together. So whoever has asked this question, it is your responsibility. I love the movie of Salman Khan, कि मैं अगर आपसे कुछ अच्छा किया एक, तो आप 3 का भला करो. Somebody remind me that movie. और वो 3 आगे 3 का भला करे. Jai Ho, or something that movie was. That's what Salman said. I'm his fan, and saying to you, today, if I could impress onto you the role of dehydration, diarrhea, non-diarrhea, your responsibility is to spread this message to more. Spread this link. I request the Economic Times to put this in the YouTube, to give this link to all. Spread it to 3 and 3 and 3, and the chase goes on. So it is we together can work to make our country, India, Bharat, Mahan.
Thank you so much, Dr. Mohan. Dr. Mohan. I have to say Mohan only.
I'm sorry, now that emotional, but I am like that.
I am sure that our audience did understand these medical terms and the important message that you gave them with the Bollywood references as well. And thank you, Dr. Preeti, for joining us. There is
Thank
a
you
lot
so
more.
much for having me over. It was indeed a pleasure to be here today on this forum. Goodbye.
Same
There
here.
is a lot more to discuss, but for this fireside, we leave it here. Appreciate Dr. Neelam and Dr. Preeti for joining us for this fireside discussion on dehydration beyond diarrhea for pediatric patients. A big thank
Thank
you to
you.
our audience.
Thank you.